When we talk about trans-arterial radioembolization, it involves two separate processes. The first procedure, the patient gets admitted and has an angiography to map the tumor, to see where the blood supply is, how much radioisotope is going to be administered. Then comes a phase of ordering the radioisotope, and then the radioisotope usually comes in about a week's time, and the patient is then, after about 1 week, he's again admitted in the hospital, again undergoes an angiography, and the Y90 spheres are delivered into the tumor. Now, to reduce this whole process and to make it more cost effective for the patient, there is a new system which is used at high volume centers. So centers where you have all the paraphernalia for doing high volume studies, you have the dosimetry softwares, you have the manpower which is trained to do these things quickly. There is a process called OMT. OMT stands for order, map and treat in the same sitting. So the isotope is ordered, we do the mapping of the tumor, so you know which part is to be administered, how much of radioisotope. The dosimetry scan is done on a specialized dosimetry software, and then the patient is immediately shifted back into the cath lab and the dose is administered. So the entire process of mapping and the administration is done in a single procedure. This reduces the patient's procedure time, it reduces the cost to the patient, and it reduces the waiting time which the patient has to have between the mapping and the actual administration of the Y90. So OMT is something which is available only at specialized high volume centers, and we are one of these centers in the country which practices OMT. So for the trans-arterial radioembolizations, be sure to ask for OMT from your center.